I'll give it another 30 seconds, Edward.
Great,
Allow
thanks,
people
bro.
to join, and then I'll kick us off. Ata Māori e koutou katoa. Tēnei te mihi atu ki a koutou katoa. Nau mai, haere mai ki tēnei webinar. Ko Grant Bergen tōku ingoa. I'm going to open us with karakia and hand over to Edward. Tuku e te wairua kia rere ki ngā taumata hei arahi i a tātou mahi me tā tātou whāinga tikanga rātou mā. Kia mau, kia ita, kia kore ai e ngaro, kia pupuri, kia whakamaua, kia tīna, tīna. Haumi e hui e, tā e
Ah,
ki e. Kia ora, Edward.
ah, ngā mihi rangatira mo te karakia mo tēnei ata. Kia ora koutou katoa, and a very warm welcome to all of you, and a very warm welcome to all of our viewers and our panelists this morning. So, the context of this webinar, I guess part of it is, progress has stalled in Aotearoa, failure to meet the Smoke-Free 2025 persistent inequities, and vaping rising due to some of the worst levels in the world. Today, our experts will talk about policy settings needed to reduce long-term harm from ongoing nicotine consumption. So it's a moderated discussion, and there is a function for question and answers. So if you're one of our viewers and would like to pop a question into the Q&A box, you'll see at the bottom of the screen an option there for you to be able to ask your questions. I'd like to welcome our speakers this morning. So getting up extremely early because she's on the other side of the Tasman, Professor Becky Freeman. Professor Freeman is a professor in public health at the University of Sydney with 25 years of experience in tobacco control. Her research, including the Generation Vape study, is highly policy focused. She is adept at sharing evidence with wide audiences. Welcome, Becky. We've also got Lani Teddy, Ngāti Ranginui, and Ngāti Rangi. And Lani is a research fellow with the Te Roku Rangahau Hauora e Eru Pomare and is also at Aspire Aotearoa. Her research explores Māori experiences of commercial tobacco and nicotine products using Indigenous methods. Lani advocates for tobacco policies that support Māori wellbeing aspirations, with her work being grounded in Te Tiriti o Waitangi. Nau mai, haere mai, Lani. And I'd also like to welcome Professor Janet Hook. Janet is a professor of public health professor at the University of Otago, Wellington, and is the co-director of Aspire Aotearoa, a research centre focused on equitably reducing nicotine use. After an early career in marketing, Janet shifted to public health, where her work has shaped major policies, including plain packaging on pack warnings, and broader tobacco endgame measures. Welcome, Janet. So I guess to set the scene this morning, I've got some quick fire questions for you all. Australia and New Zealand have taken sharply divergent paths on nicotine regulation in recent years. Australia tightening up, and Aotearoa, New Zealand, repealing its smoke-free legislation. If I can come first to you, Janet and Lani. So what is one area of nicotine regulation you would promote to make the biggest impact to reduce nicotine consumption? Lani, can I get you to go first and then we'll come to Janet? Thank you.
Sure, thank you. Kia ora tātou katoa. Thank you so much for having me. I don't know if I like that I'm going first with this, and I always struggle with picking just one thing. But I like that this question is asking about nicotine regulation because any approach has to consider all nicotine products. And for me, I think it has to adhere to Te Tiriti o Waitangi. And what I mean by that is that we want equitable outcomes, but we also want Māori authority and leadership over design and delivery of regulation that affects Māori communities disproportionately. So I guess that's my framing. If I have to pick one area, I think it would be to do with maybe density and proximity of nicotine retailers, so where nicotine is available and to whom.
Great, thank you, Lani. Janet, can I come across to you, please?
Yeah, kia ora, Edward, and thanks for that great framing, Lani. I completely agree. I think that what we need to do is to change how easy it is for people to access nicotine products. We've got to remember that we're not talking about an ordinary consumer product. We're actually talking about a product that is going to kill 2 out of 3 of the people who use it over the long term. So it makes absolutely no sense at all that we allow this product to be sold alongside everyday consumer items like bread and milk. We've got to recognise that it is a toxic substance and it needs a regulatory framework that recognises the product for what it is. So I guess I'd like to see a completely different supply model. I'd like to see much more robust regulation. I think we've got to move away from this commercial model. It's been in place for decades. It's anachronistic. It doesn't recognise the harms that tobacco use causes, and it's completely responsible for many of the serious health inequities that we're now facing in Aotearoa.
Great, yeah, and I appreciate that. Yes, I appreciate the responses, I guess, in trying to sort of narrow it down to one thing. We've only got 60 minutes, so part of it, part of what's going on for us is how do we condense all of our information that we're going to share today within this time frame. So I guess that's I appreciate that you having to sort of work out what is going to be the priority for you. Becky, how would you assess New Zealand's current stance on nicotine regulation compared with Australia's?
Sure. Before I begin, I'd like to acknowledge the Gadigal people of the Eora Nation on which the University of Sydney campuses stand and pay my deepest respects to all First Nations people and elders on the call today. Look, I just want to say from the get-go, I know there's nothing more irritating than an Australian telling a New Zealander what to do, so I am not doing that. I have learned that lesson very well, so you won't catch me saying that. But what I can tell you is about the Australian experience. And so just, the nicotine is not a consumer product in Australia. Nicotine is classified as a Schedule 7 poison. And it's given 2 exceptions. One is smoked tobacco, which obviously is the one exception we would rather not have. And the second is for therapeutic goods. So for nicotine patches, gums. So for products that have been through our TGA, which is our Therapeutic Goods Authority, and deemed as safe and effective for smoking cessation. So that's the model we have. So e-cigarettes with nicotine have never been legal to sell in Australia as a consumer good. They were sold as a consumer good very widely, very openly, under the guise that they were non-nicotine products. And of course, nobody wants a non-nicotine vape. That's a complete myth. So you would go into a shop, they'd say, oh no, I'm only selling non-nicotine vapes. You test one, it had nicotine in it. Of course it did. And so this focus for the past few years in Australia has been closing that loophole and saying we've got to get rid of this non-nicotine ridiculous sort of cover that gives to retailers. That happened. So the law now is that all vapes, regardless of nicotine content, are only available in pharmacies. In some states, you have to have a prescription, but in most states, they're just behind the counter. So you just speak to a pharmacist and you're allowed to purchase one. The vapes available in pharmacies are not flavored, they're not disposable, they don't come in pretty pictures with pretty boxes, they look like a pharmaceutical good. They look mostly packaged like you would imagine any sort of good that you got from a pharmacy is packaged. Plain pharmaceutical level packaging, restrictions on the level of nicotine, and they have to be a pod style device. So no liquids that you fill, no disposable devices. So that's what they look like, that's what's available. Of course, enforcement has not been ideal, which isn't surprising, given that vapes were so widely available all across Australia illegally that retailers were just selling these things in broad daylight to children. So it's taken a little while for that enforcement to get up to where it needs to be. But early indications from the study that I run, the Generation Vape study, shows that it is working. Young people are finding it harder to buy vapes at retailers, and youth vaping rates among teenagers have started to go down. Unfortunately, that 18 to 24-year-old bracket still has our highest levels and is stubbornly remaining flat.
Yeah, so I guess, part of this conversation is to sort of compare what's going on between our closest neighbour and, it's vastly different, I guess, in terms of policy. So, having the comparison, seeing what's been working well over there versus what's going on here, and if we can learn from each other really is all about what this conversation is for me this morning. So, Becky, while we're with you, Australia has banned social media for under 16-year-olds. So, what emerging findings are there with impacts on youth uptake of novel nicotine products?
So I just want to clarify, first of all, people like to call it a social media ban, and it's not. So under
Uh-huh.
16s are banned from having an account on a selection of social media platforms. It's very different. So I have a
Right.
14-year-old. He can still use YouTube as much as he wants. He just can't have his own account. So in some ways, YouTube now doesn't know how old he is because he's not logged in. So he can be fed more gambling ads, more alcohol ads, because YouTube hasn't got that barrier to say, oh, he's logged in under an underage account. We can make sure he's not exposed to these things. So there are some downsides to this quote unquote ban as well, that it's not working. I think that the intention was really good. I think parents are absolutely at their wits' end at how harmful social media is to young people, particularly to their mental health in some cases, the products they're exposed to, the adult content they're exposed to. I think that's all brilliant. Just some of the rollout hasn't gone as expected. The one thing that has happened in terms of vaping, though, is we clarified our laws years before. So in 2024, the rollout of this was at the end of this year of the social media ban. But in 2024, we clarified that vapes are subject to the exact same advertising bans as tobacco products. They're treated exactly the same. And of course, our tobacco product bans aren't just about protecting kids. We don't want anyone exposed to tobacco ads. Our tobacco advertising laws have never been about youth-based advertising because we recognize that every 16-year-old wants to be 20 and every 14-year-old wants to be 18. So there's no point in just saying, oh, well, you can advertise to adults, but not to kids. And so I think our laws around vape advertising are far more effective. And in fact, the TGA, before these laws came in, had taken down about half a dozen vaping ads. Now it's in the tens of thousands of how many vaping ads have been taken down. So having that media legislation has been far more effective at protecting young people than a social media ban. I think it's tempting to think, oh, if we can sort of gatekeep what young people see, then we won't need to do all these harmful product specific regulations. I'm not convinced of that yet. I think you really absolutely still need to have really strong tobacco and vape advertising bans. And it's coming through again in the Gen Vape survey. Young people reporting far less exposure to online advertising for vaping products. Where they're actually seeing vaping advertising the most is in tobacconists in stores that are still doing the wrong thing.
Right. I guess that's an interesting area for us here in Aotearoa because we're currently looking at, well, they're exploring the options in and around what social media might look like for young people moving forward. Janet, if I can come to you now, please. Your research explores vaping as a tool for smoking cessation and how to balance that with the rapid uptake of vaping among young people. How can we protect rangatahi from potential harms of vaping and what are those harms?
Well, kia ora. Thanks, Edward. What a question with just a couple of minutes to try and respond. I guess the first thing that I'd say is, I think that we need to have a much more balanced approach than the one that we currently have. It is obviously important to think about strategies that we can use to help people who smoke to stop smoking, but vaping is not a panacea. We need to recognise that, and I think we also need to recognise the harms that vaping has imposed on young people. So at the Aspire Aotearoa Centre, we've done a great deal of work talking with young people who vape, and I can tell you it's just heartbreaking to hear these stories of stress and anxiety and depression, and to know that there are actually thousands of young people who are addicted to vaping and who are having similar experiences. So I think we need to do more than we have to try and protect young people. So what would I do? Well, I would go back to my legacy in marketing. I would think about the marketing 4Ps. The first thing that I would be thinking about is how vape products are available. I mean, vaping products were sold to the government as a smoking cessation aid. That is not how they are being retailed. So if we want to make vapes available, I think that we should make them available only by people who have expertise in smoking cessation. So I would be thinking about pharmacists or or those smoking cessation services that want to supply vaping products. I think that we need a really comprehensive licensing scheme, which we don't have at the moment, and we need to consider the sorts of things that Lani was talking about, the density of outlets, the proximity of those outlets to areas where we know that young people are likely to be congregating. And we've got to have a really, really strong emphasis on compliance and enforcement. So I'd think also about components of the 4 Ps like promotion and packaging that Becky has already talked about. I think that vape should only be sold in black and white packages. I would be looking at standardizing the actual device itself. It doesn't need to come in all the different designs or beautiful colors. I would have one prototype that can be used, and it would be available in grey or beige or other colors that we know don't have those evocative connotations that appeal to young people. We know that lots of countries apply an excise tax to vaping products. I think that's something that we could consider here in Aotearoa. We could apply a modest excise tax, which we can, I think, reasonably assume would have much more of an effect on young people than on people who smoke, because we would still be able to maintain a reasonable price differential between vapes and cigarettes. And I guess the point that I'd just like to end on is that I think all of these things are really important for vaping products, but they are critically important for smoked tobacco products. So I think what we really need when we're thinking about regulating vaping is a comprehensive approach that also considers other nicotine products. So everything that we put in place for vaping should be put in place even more robustly, I think, for smoked tobacco products. So kia ora, thanks, Edward.
Great, thank you so much. And I guess, it's not just one thing that's going to get us there, really. It's obviously talking about the suite of things. They're all working in harmony to be able to reach the goals that we're wanting to get to. Lani, if I could come to you now, please. Could you describe how rangatahi are experiencing vaping products, and from what you have learnt, what policy directions would you recommend which would make the greatest impact, please?
Yeah, kia ora. So I guess when we're talking about rangatahi, it's quite a wide range of ages in that group. So you're talking about teenagers and young adults who all experience vaping products in different ways. So for some, it's clearly a harmful thing, or it's bad, it's something you shouldn't do. For others, it's entirely normal. And even if you don't vape yourself, the products are everywhere. And for others still, vaping is enjoyable, it's social, or it's a way to manage stress or difficult life experiences. So I think that diversity matters when we think about our messaging, because when you present vaping as a smoking cessation tool for some people in the population, while simultaneously warning about nicotine harm for other people, you create this confusion. One of those messages is aimed at adults, one is aimed at young people, but you can't control who's receiving which message. And that framing that vaping is less harmful than smoking, or it's not harmless, it asks people to do a bit of work to interpret what that actually means, like less harmful than what, for whom, and under what circumstances. So it's not the same thing as simply saying vaping is not safe. And that ambiguity might not be something that is explored with young people. They hear the messages, but not the nuance behind them or who it applies to. So the way that vaping is experienced by rangatahi is that it is woven into their social world. Their peers vape, it's more socially acceptable to vape than smoke. It's more acceptable than smoking. The devices are designed to be used anywhere, and that's exactly how they're being used. What I'm learning from young people is that they are concerned about the impacts of vaping not only on themselves, they're worried about younger people taking up or being exposed to vapes. And they're worried too about the well-being of the adults in their lives who are smoking or vaping. So whether a young person uses these products or not, they're still affected by who is using them around them. And the other part to this question is about policy. So in terms of policy in our current laws, the awareness of policy and then the experience of it are kind of two different things. So most young people know the legal purchase age of a vape in Aotearoa. Although some people do think it's 16, most know that it is 18. Most young people know that vapes are intended to be a tool to support people who are currently smoking. Young people who are in school, they know what the rules are for vaping on school grounds and what the consequences are if they are caught. And some young people know about the pharmacy model in Australia, and they quite like that. But aside from that, any new requirement that's come into effect, they're not really aware of it. And if young people are not seeing any difference in availability or access to nicotine as a result of policies that are being introduced to protect them, then I don't think it's enough. It doesn't go far enough, or it's not being implemented or enforced in any kind of meaningful way. So again, retail proximity and density are examples of this. We can probably all think of a school that has a vape store right across the road. And that's despite the introduction of legislation in 2023 restricting new specialist vape stores from being within 300 metres of a school. So that wasn't applied retroactively. It only applies to new vape stores. So, young people, that doesn't make sense to young people. We all know of places that have more vape retailers than any other kind of store in one row of shops. And then young people who are underage will also talk about retailers who do not check ID. So I think if I was to put together a list of policy that I think young people would be supportive of, that would include standardised packaging, reduced flavour descriptions, addressing retail and proximity to schools, marae, ECEs, in a consistent and clear way, reduce the number of retailers to bring down the density of vape stores in communities, enforcement to ensure we have adequate workforce and resourcing to monitor current retailers, and addiction support as well. So what does that look like in a school, in a community? What does that look like when it's purpose-built for rangatahi who have never smoked? So how are we supporting young people to cope without nicotine? And then beyond people who are using nicotine, how are we supporting young people to not reach for a substance when life is hard, stressful, or when they're faced with immense peer pressure? And then, of course, there are our te tiriti obligations. So the right to be free of nicotine addiction, and the obligation, too, to protect rangatahi from nicotine harms. So that requires true adherence to te tiriti. It requires actually caring about public health policy and how that is experienced by Māori. And it requires real partnership and the valuing of Māori leadership. And all of that, everything I've just said, all requires really strong political leadership too. Thank you.
Great. Thank you for that really comprehensive answer. I think the great thing for me, because a lot of that I wasn't able to take in just while you were saying it, but the great thing is that, that we're recording these sessions and these sessions will be available on YouTube. So I'll be going back to actually having another listen to all of the measures that you put in place there. And I guess too, when you're talking about rangatahi at ages, in a Pacific context, sometimes rangatahi are just people who are not married. So when you're looking at age groups, across the different cultural realms, for people that I know, if they're single, they are still classed as rangatahi, which I thought was an interesting way of looking at things. Okay, we're going to do a lobbying quickfire for all. Janet and Lani, I'll come to you first, and then I'll come to you, Becky. So what do we need in Aotearoa to reduce lobbying? Quick reflections on your top list of policies. Janet, please.
Well, thanks, Edward. Well, I think what we've seen over the last couple of years here in Aotearoa is that lobbying has had a really profound influence on policy in general, not just public health policy. But when we think about tobacco control policy in particular, I think the first thing that I would do is to remind our political leaders that we are in fact a signatory to a global treaty that requires all of its parties to protect policy from the influence of the tobacco industry. And I would encourage them to reflect on how comprehensively and how adequately they've provided that protection. So thinking about specific measures that I would introduce for lobbying, I mean, clearly we need much, much greater transparency than we have at the moment. So I would be thinking about mandating lobbying registers, and those registers would need to be really comprehensive. They would have to provide complete records, very timely and up-to-date records of all interactions, not just between ministers, but between ministers, MPs, staff and political officers, public servants, and industries that operate with commercial interests. So I think that's probably the first thing that we need. We need to know who's doing the lobbying and who are they approaching. We need to have mechanisms to slow down the revolving door. So we need to be able to stop people from being in a political context where they hear sensitive information that's clearly of interest to industries and then moving into those industries. I think we need to have a code of conduct, and we also need an independent body that is going to be able to act proactively to investigate concerns and also to investigate complaints. And that body needs to be able to impose sanctions. I guess that's what I would put in place to try and regulate lobbying. But I would also say that I think it's impossible to eliminate lobbying. And to me, that's a really important reason why we have to keep critiquing and evaluating the arguments that lobbyists use. I don't think that's particularly difficult because they tend to recycle their arguments, and those arguments, they often lack logic and they lack evidence, or they don't have either. And I think that's a real role for the academic community. And I think we've got an opportunity to lift our game and be more outspoken in critiquing the kinds of arguments that lobbyists put forward. So kia ora, thanks, Edward.
Thank you, Janet. Lani, have you got anything to add to that?
That was such a comprehensive answer, Janet. It's quite hard to add to what you've just said. I completely support everything that you just mentioned. My answer is probably really short. Regulated, just regulated. I don't think it's useful to have self-regulation or voluntary codes. Like, we need proper regulation because people are after transparency. They want clarity, fairness, and accountability too. So like Janet said, awareness of FCTC obligations by government officials and adherence to it would be absolutely great. But I think very clear legal requirements in Aotearoa would be better. And not just for tobacco, but for any industry that stands to profit disproportionately.
Nice, kia ora. Becky, how successful has Australia been in counteracting lobbying from tobacco and vaping industries? And what strategies have proven most effective on your side of the Tasman?
Yeah, so first, I think it's important to understand that the advocacy ask around improving our vape laws, that all vapes, regardless of nicotine content, must be available in pharmacies only for people who are using them to quit smoking. That was our key. We repeated that ad nauseum by everyone. All of the research was geared towards achieving that goal. All the key messaging was focused on that. All our meeting with politicians was focusing on that. That's how you get a big policy like that across the line. You become, singularly focused as a sector. It becomes boring if you like, but that's what you need to do, is to have that like razor sharp focus where everyone can keep saying the same key messaging, keep pointing out with their research, with their advocacy, why that closing that loophole was important. So that was our singular focus, and that's how we got it over the line. On the other hand, here we have industry who is saying, absolutely, we need to regulate vapes. We fully agree. This is terrible. Unregulated vapes are terrible. But as Philip Morris and British American Tobacco, we're respectable, regulated companies. And if you regulate vapes and allow them to be sold in retailers all across the land, we will make sure that our products are nice and regulated. They won't be like these harmful vapes, these terrible vapes, where you don't know what's in them or who they're being sold to. And so that was the alternative advocacy message that was being had. And you could see why they would do that, right? Because these are companies who already have supply chains very well established. They already have relationships with every retailer in the country because cigarettes are sold everywhere. And in fact, from internal documents, I had a PhD student who interviewed former tobacco industry employees as part of her PhD. And we knew that their plan was, as soon as vapes and heated tobacco products were regulated, their plan was to put them in pubs and clubs and bars. And that they had already established sales units, if you like, where they would simply take out the cigarettes and put in heated tobacco products. This was Philip Morris's plan to get IQOS into venues where young people were. And exposing those kinds of things is a key part of holding the industry to account. That requires resources, it requires time, it takes your focus off of your advocacy ask because you're having to bat away the other side and expose what they're doing. We're seeing this now in I guess, tenfold in our illicit tobacco crisis, which I know we'll get to, but it's important at this point to show the industry has absolutely ramped up its messaging and its allies. And now public health is doing more of the batting away of the, no, we do not need to cut the tax. No, that is not the solution, that we're not able to focus on our advocacy asks. That's getting lost. And the industry is absolutely drowning out everything with their very sexy 3-word cut the tax slogan. If I was just looking at advocacy from a distance, I'd be like, wow, those industry people really know what they're doing. They really know how to public message. They really know how to bring on people to amplify that message. And that's what we're seeing happening. I've written for the conversation very recently about the things Janet was just talking about, the donations to political parties, the revolving door, and appearing at Senate hearings in secret is another way they're doing this. So we have exactly the same problem in Australia with industry continuing to interfere and lobby. The only thing that is effective is fully implementing Article 5.3 of the FCTC and ensuring that industry is not allowed to have an influence on public health policy, and ensuring that health groups understand how to take on industry messaging and can do that as part of their advocacy efforts. We can't just, ignore what the industry is doing. We have to actively counter it.
Nice, thank you. I'm going to move across into inequities now. So for Lani and Janet, New Zealand past successes in reducing smoking rates has stalled, and inequities persist with smoking prevalence among Māori at around 15%, twice that of the general population. So our Pacific people and those living in lower socio-economic areas are not far behind. What measures should Aotearoa introduce to address those inequities? Lani, please.
I feel like this one question could be a whole webinar by itself. So obviously I'm going to talk about te tiriti, and I feel like that is treated like this 186-year-old debate. So while te tiriti is a living document and that it's not static, it should not be subject to the kind of one-sided flexibility being applied by our current government. Which is trying to make these unilateral decisions about the role of te tiriti and its obligations. So we currently have people who want to tutu with te tiriti to diminish its importance and its application to things like inequitable smoking and vaping rates. We have people who want to shift accountability from systems and policies that hold inequities in place and blame individuals for taking up products that are saturating their communities. The inequities that we have at the moment are a result of ongoing colonisation, socio-economic pressures, commercial determinants, predatory industry tactics, and resistance to tino rangatiratanga and Māori-led solutions. So in 2022, we had measures in super, so the Smoke-Free Environments and Regulated Products Act, that directly addressed some of the things that would have supported equity, so reducing retail, lowering of nicotine levels, and the smoke-free generation. So those were all repealed, and included in that repeal was the inclusion of Māori governance as well. So in essence, we had tools, or in te tiriti, we still have a tool that we could utilise to address inequity. The other thing I want to talk about is that we have some amazing cessation support services out there. So these are services that fit Māori realities. They achieve Māori health ambitions. They are whānau-centred. But what we need to ensure is that those are funded appropriately and without any requirement that vaping kits be distributed, because that links back to what I said earlier about resistance to tino rangatiratanga and Māori-led solutions. Because for some, the source of the nicotine is not the only consideration, it's also about freedom from addiction. I was just reading something from Tina Ngata, so I feel like I'm about to borrow from her in a really big way. When you look at the tobacco system, te tiriti can be about how power is managed within that system. So at what levels are Māori participating in governance and decision-making and the protection of taonga, which in this case is hauora or well-being. So health equity is actually the minimum, flourishing people is the goal. So I feel like I've mixed in a bit of Moana Jackson as well as Tina Ngata there. But I'll leave it there. Thank you.
Kia ora. Thank you, Lani. Janet, if I can come across to you now, please.
Yeah, so that was an incredible response, Lani, and I just really want to acknowledge the important comments that you made, and to endorse your call for a strategy that is driven by Māori and Pacific peoples, and a recognition that they know what is going to work within their communities and that they need the support, the authority, the power, the resourcing, all the kinds of things that you have talked about. And I think if we are serious about making a difference, then we do get in behind the call that you've just made. I think we've talked, quite a lot about structural determinants of health, and Lani also mentioned commercial determinants of health. And I guess that I would just come back to those and call out the tobacco industry yet again. I mean, one of the key reason why we have health inequities is because there is a predatory industry that has cynically and systematically targeted particular population groups, yet we're still allowing that industry to sell its products as though they are everyday, normal consumer goods. So I think that we need a really fundamental shift in how we view and how we regulate tobacco products. And once we recognise smoked tobacco as a toxic product, and I was really interested in what Becky had to say about the framing and regulation of tobacco, I think that is something that we could really learn from. Once we recognise it as a toxic product, regulate it in that way, control its supply much more effectively, then I think that we could make much better progress in reducing inequities. So kia ora. Thank you.
Kia ora. Okay. Becky, illicit tobacco time. So thank you for bringing that up. And yes, now is an opportunity to have a look at that area. We hear a great deal about what's going on in Australia with the illicit tobacco problem, which is, but also that's on the rise here too. So at contested rates, but perhaps I'll come to you first. How bad is the issue in Australia, Becky? And then we'll look at what's going on in Aotearoa, and then I'll be able to sort of draw some more additional information from Janet and Lani. So what's going on in Australia with illicit tobacco, please,
Sure.
Becky?
Look, I think globally, tobacco control as a sector or a movement, however you want to position it, has been really fantastic and really focused on what I would call demand reduction measures. So making smoking less attractive, more expensive, less socially acceptable, pushing it out of that sort of charm circle of socially acceptable practices to out here where it's something like we want people to regret ever having started and we want to get them to quit, right? And we want this to be a good that people don't want to buy. But what we haven't done alongside that is regulate how tobacco is supplied. People in the sector have been calling for that for decades. This is not a new radical idea to manage how tobacco is sold and supplied. In fact, I think it's as old as time that people have been saying, why is this product being sold here? This makes no sense. It's incredibly addictive. It's ridiculously dangerous. And now it's also highly taxed. You should have to be an incredibly responsible, well-vetted establishment to be able to sell such a product. And yet we allow a corner shop that just opened up yesterday to sell it. By filling out, in Australia, you do have to have a license, but there's no criteria of who can be a license. As long as you fill out the paperwork and pay the fee, you can sell this product. And now with the advent of illicit tobacco absolutely going through the roof, people just aren't bothering to get a license either. They're like, oh, well, if I don't have a license, at least I can't, they can't find me as quickly to know that I've sold this product. But in some ways, it's a bit ridiculous because we haven't done anything to try and limit the number of shops anyway. There are estimated to be 40,000 retailers all across Australia that are allowed to sell tobacco products, that do sell tobacco products. My own neighborhood, I live very close to the University of Sydney. For anyone who's been to Sydney, it's the inner west. Just down the street on the corner, what the closest convenience store to me. I was in there just the other day. I like to just, go in, have a watch, see what happened. Someone comes up to the counter. Can I get a pack of those cheap cigarettes? No problem. Goes under the counter, gets out the cheap illicit cigarettes. The customer says, oh, actually, I've only got $5. They're like, oh, well, I'll give you half a pack then. Pulls out half a pack, puts it in his hand. This is happening broad daylight. This is not a quote unquote black market, a term I would never use for obvious racist reasons, but it's not a black market when it's in broad daylight, when it's not hidden at all, when it's happening absolutely everywhere. My local bookshop is about to be replaced by a tobacconist. And so you think this is a country in Australia where we have less than 10% of people smoking every day. Um, Youth smoking rates are bottom under, 1.5%. Why are there new tobacconists popping up? It's because they're being supplied by illicit tobacco. And illicit tobacco is absolutely everywhere. Latest estimates are between 60 and 80%. In some ways, it doesn't matter what the precise number is here. This is a massive problem that is absolutely infiltrated everywhere. And there are a couple reasons why it's taken off. Number one is because of the illicit vapes that I told you about before. Those supply chains were tested very well during COVID. It became very clear that you could sell an illegal product in broad daylight and nothing would happen to you. The health authorities would do nothing. So the vapes are a nice test for that. We now have illicit tobacco has stepped into that space as well. It's incredibly profitable, far more profitable than vapes. It's very cheap to manufacture a cigarette. You can manufacture a cigarette in some Southeast Asian countries for less than 30 cents a pack. Costs absolutely nothing. So you oversupply the market, you manufacture absolutely millions and millions of cigarettes. You then dump them into Australia. Let's say Border Force is able to seize even 60% of that. You're still getting 40% across the border. If you only paid a couple cents per pack for that and you sell them for a few dollars, you're still making millions and millions of dollars. So the problem is the whole supply chain is the issue. The solution that's getting the most traction right now because of industry funding of a massive campaign and our national party that is complicit in pushing that message is to cut the tax, that this will somehow solve it. But honestly, you would have to get rid of the tax almost completely. So go back to the last time we had zero tax, I believe was in the 1940s, if I remember, is when tobacco first started being taxed, in order to quote unquote compete with criminal gangs. It's nonsense that cutting the tax will somehow solve this problem. And I don't know of any other law where we say, well, people are still speeding, so you know what? We'll just get rid of speed limits. We'll just let everyone speed, and then we'll have no speeders because speeding won't be a crime anymore. Or, let's get rid of our gun laws because some people still are getting guns, because then we won't have any gun crime because guns will be legal. So the idea that we should get rid of our vape laws so that all vapes are legal, we should get rid of our tobacco taxes so cheap cigarettes are all legal, has no public health bearing whatsoever. And it's really frustrating to me just how powerful and how well resourced that message is. I could go on and on about this issue. As you can tell, it's very top of mind. It's very passionate at the moment. But I'll leave it there and let other people speak now. Thank you.
Sure, and I guess it's really topical and top of mind because of its prevalence, really. So if it wasn't a problem, it wouldn't be top of mind, but we're seeing it more and more, not only in Australia, but here in Aotearoa and internationally. So if I can come to you, Janet, how bad is it here in Aotearoa, and what maybe would be some key measures to combat illicit tobacco right here in our home country?
Well, thanks. That's a really challenging question, Edward, and I don't know that we have a really precise estimate of illicit tobacco here in Aotearoa. We had a new estimate from a Tobacco Industry Commissioned report yesterday it doesn't align with the kind of evidence that independent researchers have been documenting. But I think we do need to recognise that the market is evolving incredibly quickly. So it's difficult to put a precise percentage on illicit tobacco within our marketplace. I think instead of trying to focus on estimating the problem, what we need to be thinking about is how we address it, how we preempt it, how we avoid the kind of situation that Becky's just described for us in Australia. And to me, the most important thing that we can do is to reduce smoking prevalence as quickly as possible. Lani's already talked a little bit about the super measures. We know that those measures were predicted to reduce smoking prevalence very rapidly, and that they would have pretty much eliminated the inequities that we find so deeply troubling. I think we've got to go back and identify measures that are going to reduce smoking prevalence really quickly, because if we can get the market for illicit tobacco to be an unviable market, then people are going to lose interest in trying to supply or operate within that market. So to me, reducing the number of people who smoke as quickly as possible is just going to reduce the appeal of operating as an illicit tobacco supplier. How do we go about doing that? Well, we do know measures from the SERPA legislation that could be revisited, regardless of whether we adopt those measures or not. I think we need a really coordinated strategy, and that strategy has to be completely independent of tobacco companies. I mean, it does worry me the way that tobacco companies are operating through associations, trying to get a voice at the table, and we're already seeing them socialise the sorts of arguments that Becky was talking about, that, you know, we should be thinking about the problems that high excise tax has created. I mean, we know that those arguments are driven by self-interest, not by goals of population well-being, and we really need to make sure that those voices are not influencing policy. We need a system or a strategy that's got integrated detection and enforcement. I think that there are parts of our current system that aren't operating in alignment, so we need to bring those into alignment to enable much more rapid detection and then action to be taken. I think that we need measures that are going to hold the complete supply chain accountable. So obviously we need to hold retailers accountable, but there are also landlords who allow premises to be used to supply illicit tobacco. The supply chain goes back beyond the person who's supplying the cheap pack or half pack or bag of loosies or whatever over the counter. And we need to make sure that that complete supply system is accountable. And we need much better comprehensive enforcement and really severe penalties. At the moment, the penalties that we have in Aotearoa, you know, they're just not meaningful. So we need to make sure that they are penalties that really do act as a deterrent. To me, it's pretty clear what we need to do. I don't think that any of the steps that I've set out will be a surprise to anyone. And I think, though, that our starting point in implementing those measures is to have a really comprehensive licensing scheme. So kia ora, that's my bit. Thanks.
Nice. Thank you, Janet. Lani, have you got anything to add to that?
Again, really comprehensive answers by both Becky and Janet there. I guess I'm more on the periphery of this issue and how to actually address it, but I think understanding the current roles and powers of some of our organisations like customs, police, smoke-free enforcement officers, and like Janet mentioned, there are probably other agencies and people that need to be part of that accountability frame as well. But knowing what regulations we currently have and how this applies and who it applies to. So thinking about what else do we need? Do powers need to be expanded? Do we have the workforce that is needed? Like Janet mentioned, are there immediate consequences if caught selling, like fines and closures? And then overall, how do we properly fund and resource this? So I have more questions, I guess, than answers.
I guess with those questions are, you know, it's good to put those questions out there because it gives us an opportunity to be able to respond in time. The chat's been going crazy, ladies. I'm not sure if you've noticed that, but we seem to have lots of people online and lots of people sort of wanting additional information from you. So your time and your expertise is precious here. So I'll come to a couple of questions because we've got time actually, which is great. Often we sort of run out of time, so it's nice to know that we do have some time available for some questions. So here we go. The people who support introducing nicotine pouches point to their success in Sweden for reducing smoking rates. How comparable is the Sweden situation to New Zealand, when we already have low smoking rates? The people who support introducing nicotine pouches point to their success in Sweden for reducing smoking rates there. Would anyone like to have a tackle at that?
I can just talk about the Australian view on this if you like.
Thank you very much. Thank you.
So I think the Swedish experience gets kicked around a lot, and I just want to sort of clarify a few myths there. The nicotine pouches in Sweden have opened up additional markets, so they're more appealing to women and young people who had never used Swedish snus before. who already were not smoking. So this is not taking a bunch of people who smoked and then moving them over to pouches. It's like smoking rates in Sweden are really low. Women and young people don't really use this snus product that's been around a long time. We can introduce pouches, and there's a whole new market of consumers here that we're not reaching. And so young consumers and women are disproportionately using these nicotine pouches. They're flavored, they're marketed, they're attractive, they're used by well-being influencers, et cetera, et cetera. So I think this myth that you've somehow displaced a bunch of people who were smoking and were never going to quit and got them on pouches, that's not what's happening. It's that you have low smoking already, and we need some new nicotine consumers, and pouches are a way to be a new nicotine consumer. So in Australia, nicotine pouches, because of the way we regulate nicotine, as I mentioned at the beginning, as a Schedule 7 poison, have never been legal and are not currently legal. We are monitoring use of that, again, through various surveys. In my own survey, the Gen Vape study, thankfully, use among teenagers remains very low. We're having less than about 3% of teens have ever tried a nicotine pouch. In the qual side of things, teens we speak to who have tried pouches actually really don't like them. They find them really strong. I think we're not getting the light nicotine pouch products through here. We're getting quite the strong nicotine pouches. So if you're a novice nicotine user, that can be a very unpleasant experience when you first use them. 18 to 24-year-olds is quite a different picture. We're seeing numbers, particularly among smokers or people who've tried vaping before. Pouch use is becoming increasingly common to have tried these products. Again, daily use remains quite low. They're accessing them through online channels and through retailers, just like vapes. So it is absolutely, they're getting into Australia, being sold at retailers, these same retailers who are selling illicit tobacco and illicit vapes. It all comes back to our supply chain problem of that we allow these products to be sold everywhere to everyone. And unless we address that, the next nicotine product that comes on the market will join that sort of, I guess, group of products to have nicotine for every occasion for everybody at any time. I was just in an international airport, saw a lovely display of Zins, the PMI product, and it was absolutely, you can't smoke or vape on a plane, but these Zin products will get you through. That's not a cessation message. That's a keep your nicotine addiction going as much as you can so that as soon as you get off the plane, you can have your preferred product, which is probably a cigarette. You can keep your nicotine, your vape in your product for when you can have a cheeky vape when no one's looking. And then when you absolutely can't smoke or vape, you've got a pouch to keep you going as well.
Thank you. Janet and Lani, anything else to add to that?
Yeah, I would endorse the comments that Becky has made. And I think that what we need to do is to think about addiction rather than nicotine products. I mean, tobacco companies are really nicotine product companies now, and their profits depend on making sure that they have got products available for people regardless of the situation that those people might be in. We've done a little bit of work talking with young people about the use and access of oral nicotine pouches. They're importing them into Aotearoa because they find loopholes that enable them to do that. Some of them have tried the very high strength products that Becky was talking about, and obviously that's an experience that is quite off-putting, but they will persist with it because their friends have accessed these products overseas or have seen social media promotions that position and frame oral nicotine pouches as highly desirable items. It just encourages them to keep going. So I think pouches are a way of extending addiction. They're not a way of resolving addiction.
Nice. Okay, we're fast running out of time. We've got about sort of 7 minutes left. I do have this question here. Look, we're coming up to an election. So could each panelist share one concrete recommendation for regulatory reform that would strengthen New Zealand's approach to nicotine products, or for Becky, Australian nicotine products? So I'll come to you first, Janet, then we'll go to Becky and then to Lani. Janet, you're on mute.
Apologies for that. I guess it's no surprise if I say that I would like to see a really comprehensive licensing system. And by comprehensive, I mean a system that enables us to regulate who's selling tobacco, how many sellers there are, the products that they are permitted to sell, the prices that they are able to charge. And I guess in my sort of regulatory nirvana, I would even like to be able to control the number of products, the amount of product that they are able to sell. So I think that we need to move back and think about how we're going to control supply of tobacco and nicotine products. Kia ora.
Thank you, Janet. Becky?
Oh, we don't have an election coming up in Australia, but we do have an illicit crisis, and every crisis is an opportunity. And if I were in charge for a day, I would call an emergency summit, equivalent to what we had during COVID, an emergency. And I would say, look, this is an emergency. We have illicit tobaccos out of control. We have an industry who's controlling the narrative, who has very deep pockets. We have criminal gangs who have moved into the tobacco supply space. This demands an absolutely whole of government emergency response. I would immediately move to nationalize tobacco retailing and absolutely slash the number of retailers from 40,000 down to a more manageable number. Probably would need to reduce that by about 90%, I'm guessing. And we would throw everything but the kitchen sink at reducing tobacco use all at once. That's a hard advocacy message to distill into a 3-word slogan like cut the tax. But I think that's what we're facing here in Australia, is that our public health sector, our tobacco, is going to need to figure out how to message that and package that in a way that makes sense to people that they can get behind. Be that shut the shops or end tobacco, whatever it is that we're going to need to get to. I think that's going to be our real test over the next 6 months, is how we're going to combat that cut the tax message that has been so pervasive.
Thank you, Becky. Lani?
For me, I think there is no one recommendation, and I'm probably going to end the way that I started. There's no single approach. Any approach has to consider all nicotine products and has to adhere to Te Tiriti o Waitangi and our FCTC obligations.
Great. Well, look, thank you so much. So I'm going to close this off now. Look, I'd like to thank everyone for their questions. All the questions that are in there will be distributed to the panelists, so we'll be able to sort of come back in time. This is being recorded and it will be available on the YouTube channel. I've got a note here to please check out Aspire's upcoming symposium, Achieving a Nicotine-Free Aotearoa. That's on July the 2nd, 2026. And there is a link in the webinar chat, so you'll be able to register there. Look, I guess in terms of, we've covered a lot in this last time since we've been sharing time and space over the last hour. So, what's going on in Australia? This is what's happening here in Aotearoa. We've talked about lobbying, we've talked about the inequities, we've talked about priorities, we've talked about illicit tobacco. And, there's been a lot of rich information shared. So I'd really love to thank Becky, for getting up so early, because of course she's 2 hours ahead of us on that side. So thank you for waking up early and joining us today on the panel. To Janet and to Lani, thank you very much for your expertise and your experience. It's nice to be able to dedicate time and space to just be able to be here and share your knowledge and information with all of the viewers. So I'm going to hand back to Grant. I'd like to thank you all. Thank you for joining us also on this webinar, and you'll be able to catch this on YouTube. We'll be able to send you the links. Go well, enjoy the day. Thank you. Kia ora.
Kia ora, kia ora, Edward. And I just want to reiterate our thanks to the panel for a fabulous and important wānanga. And I'll close us with karakia. Hikitia te rongo mai whiti o tēnei kaupapa, tukua kia ea, tukua kia oi, ko rangi nui ki runga ko papa tuanuku ki raro, tu turu whakamaua kia tīna, haumi e hui e, tae ki e, kia ora tātou.